Truck driving is often romanticized as a life of freedom on the open road, miles of highway, changing landscapes, and the independence of working alone. But beneath that image lies a demanding and often hazardous profession. Truck drivers face a unique combination of physical strain, long hours, mental pressure, and environmental risks that make them particularly vulnerable to a wide range of injuries. Some of these injuries happen suddenly, like falls or accidents, while others build slowly over months or years until they become serious health problems. Understanding these risks is important, but what truly matters is knowing how to prevent them and protect long-term health. One of the most common and debilitating injuries among truck drivers is back pain. Conditions like herniated disc and sciatica are especially prevalent in this profession. The root of the problem lies in the nature of the job itself. Drivers spend hours sitting in the same position, often with less than ideal posture. The constant vibration from the truck adds stress to the spine, while loading and unloading cargo can involve heavy lifting that strains the lower back. Over time, this combination can lead to chronic pain or even permanent injury. The solution begins with awareness. Adjusting the seat to provide proper lumbar support, maintaining good posture, and taking short breaks every couple of hours to stretch can significantly reduce spinal stress. Strengthening the core muscles through simple exercises also helps stabilize the spine, making it more resistant to injury. Muscle strains and sprains are another common issue, and they often occur when drivers underestimate the physical demands of their work. Lifting heavy cargo, pulling equipment, or even making sudden movements can strain muscles in the shoulders, neck, arms, or legs. These injuries might seem minor at first, but they can worsen if ignored. Many of these problems can be avoided with simple precautions. Warming up before physical activity, using proper lifting techniques, and relying on mechanical aids like dollies or lifts can reduce strain significantly. It's also important for drivers to pace themselves rather than rushing through tasks, as fatigue increases the likelihood of injury. Knee injuries are also widespread in the trucking industry, largely due to the repetitive motion of climbing in and out of the truck cab. Over time, this can lead to conditions such as tendinitis and osteoarthritis. Many drivers make the mistake of jumping down from the truck instead of using the steps, which puts additional stress on the knees. Preventing these injuries requires a combination of good habits and physical conditioning. Always using handrails and steps, wearing supportive footwear, and strengthening the muscles around the knees can go a long way in reducing long-term damage. Repetitive strain injuries, often referred to as RSIs, develop gradually due to repeated motions over time. Truck drivers are particularly at risk because of constant steering, gear shifting, and handling of equipment. One well-known example is carpal tunnel syndrome, which affects the wrists and hands. Symptoms such as numbness, tingling, and reduced grip strength can make even simple tasks difficult. Preventing RSIs involves making ergonomic adjustments, such as positioning the steering wheel correctly and using gloves that reduce strain. Regular breaks to stretch the hands and wrists are also essential in minimizing the risk. Slip, trip, and fall injuries are among the leading causes of serious harm in the trucking profession. These accidents can occur when climbing in or out of the truck, walking on uneven surfaces, or dealing with slippery conditions like rain, ice, or oil spills. The consequences can be severe, including broken bones, head injuries, or long-term mobility issues. Fortunately, many of these incidents are preventable. Following the three-point contact rule, keeping 2 hands and 1 foot, or 2 feet and 1 hand, in contact with the truck at all times, provides stability and reduces the risk of falling. Wearing slip-resistant footwear and taking a moment to inspect surfaces before stepping can also make a significant difference. Head injuries and concussions are another concern, often resulting from falls or accidental impacts with low-clearance structures. These injuries are particularly dangerous because their symptoms are not always immediately obvious. A driver might feel fine initially but later experience dizziness, confusion, or headaches. Taking precautions such as being aware of surroundings, ensuring proper lighting, and avoiding rushed movements can help prevent these incidents. It's equally important not to ignore symptoms if they do occur, as early medical attention can prevent more serious complications. While many of the injuries discussed so far are physical, Truck drivers also face serious health risks related to their lifestyle. Cardiovascular issues, including heart disease and hypertension, are alarmingly common. Long hours of sitting, combined with stress and limited access to healthy food options, create a perfect environment for these conditions to develop. Addressing this requires a proactive approach. Drivers can plan meals in advance, choose healthier options when available, and incorporate physical activity into their daily routine. Even short walks during breaks can improve circulation and reduce health risks. Closely related to cardiovascular problems is the issue of obesity and metabolic disorders, including type 2 diabetes. The sedentary nature of trucking, combined with irregular eating habits, makes it easy for weight gain to occur. Over time, this can lead to serious complications that affect overall quality of life. Preventing these issues involves making consistent, manageable changes. Packing nutritious meals, staying hydrated, and incorporating simple exercises, such as resistance band workouts or bodyweight movements, can help maintain a healthy weight even on the road. Fatigue is another major concern that cannot be overlooked. Truck drivers often work long hours, sometimes under pressure to meet tight deadlines. This can lead to chronic exhaustion and sleep disorders such as sleep apnea. Fatigue doesn't just affect health. It significantly increases the risk of accidents by slowing reaction times and impairing judgment. Managing fatigue requires discipline and prioritization. Maintaining a consistent sleep schedule, creating a comfortable sleeping environment in the cab, and recognizing the signs of exhaustion are crucial steps. Drivers should never push themselves to continue driving when they are overly tired. Mental health is another aspect that deserves attention. The isolation of long-haul driving combined with stress and irregular schedules can lead to feelings of loneliness, anxiety, and depression. Unlike physical injuries, these issues are often invisible and therefore easier to ignore. However, they can have a profound impact on overall well-being and job performance. Staying connected with family and friends, finding ways to stay mentally engaged through audiobooks or podcasts, and seeking professional support when needed can help maintain emotional health. One of the most obvious risks in trucking is the possibility of accidents. Collisions can result in a wide range of injuries, from minor bruises to life-threatening trauma. While not all accidents can be prevented, many are avoidable through defensive driving practices. Staying alert, maintaining a safe distance from other vehicles, and adhering to speed limits are essential habits. Regular vehicle maintenance is equally important, as mechanical failures can increase the likelihood of accidents. An often overlooked issue is the effect of whole-body vibration. Spending long hours in a moving vehicle exposes the body to constant vibration, which can contribute to chronic pain, fatigue, and circulatory problems. This may not seem significant in the short term, but over years of driving, it can take a serious toll. Solutions include using well-designed suspension seats, maintaining the vehicle properly, and taking regular breaks to stand and stretch. Ultimately, the key to preventing these injuries lies in building a consistent routine focused on health and safety. Small daily habits can make a big difference over time. Stretching before and after driving, staying hydrated, eating balanced meals, and listening to the body's warning signs are all simple but powerful strategies. Prevention is always easier and far less painful than treatment. Truck drivers play a vital role in keeping economies running, yet their health challenges are often overlooked. The demands of the job require strength, endurance, and resilience, but they should not come at the expense of long-term well-being. By understanding the risks and taking proactive steps to address them, drivers can protect themselves and continue to perform their work safely and effectively. Maintaining health as a truck driver is not about making drastic changes overnight. It's about consistency, awareness, and making better choices whenever possible. Just as a truck requires regular maintenance to perform at its best, the human body needs care and attention to stay strong and reliable. By treating health as a priority rather than an afterthought, truck drivers can ensure that they are not only able to do their job but also enjoy a better quality of life, both on and off the road.